In conclusion, it brings me great pleasure to present a good friend and mentor and the previous Commissioner for the Department for the Aging, Lilliam Barrios-Paoli. Lilliam is the Deputy Mayor for the Department of Health and Human Services for the City of New York. And as I mentioned, Lilliam was appointed Commissioner of DFTA in 2008, following a long career in both city government and the not-for-profit sector. Her prior public service includes appointments as commissioner at several agencies during the Giuliani and Koch administrations, the New York City Human Service Resource Administrations, and before that, New York City Housing Preservation Development and the New York City Department of Personnel. Lilliam has also been a leader in the non-for-profit sector and served as the executive director of Lincoln Medical and Mental Health Center. In addition to a distinguished career, Dr. Barrios-Paoli has a bachelorette degree from Universidad Iberoamericana and a master's and PhD degree in cultural and urban anthropology from the New School of Social Research. She has taught at the City University, Bank Street College of Education in New York City, Rutgers University, and Montclair State College in New Jersey. Welcome.
Thank you, Donna. As my resume gets longer and longer, I get tired and tired. It's a real pleasure to be here. I want to thank Secretary Burke for having come and shared with us, and certainly Commissioner Donna Corrado, and all of you for being part of this. I hope that today's discussion has been fruitful for all of you, and I hope that you can see the promising synergies that can be possible and are being possible in this new world in healthcare. One of the things that I have, I guess not learned because I sort of knew, but seen very plainly and painfully, is the tremendous change that healthcare is undergoing just as we speak. In my portfolio is the hospital system, the Health and Hospitals Corporation, and the Department of Health. And the most remarkable thing, having worked certainly at HHC at two different points in my life, but having worked closely with the Department of Health, is a profound change in the vision of what the mission of those two systems are. For health and hospital, it's always been the patients come to me. I do through the emergency room by and large, unfortunately. I do my best in inpatient, and then you go away, and that's it until you come back to the emergency room, whenever that is. And for the health department, it's been I control infectious diseases, and I, do a lot of scientific work, and that's what I do. And I tell people how to avoid those terrible things. And in the last few years, we've began to make some strides towards other things that could impair healthcare. But the big change I've seen in both systems has been the idea that sick care in the hospitals is no longer where it's at, that it's well care, that we have to anticipate the sickness before it happens so that people don't really come to me, so that primary care and preventive care is really where it's at. And in the Department of Health, the idea that health is not just what happens to my body in terms of disease or pathogens that invade me, but it is the environment around me. It is whether I'm poor or I'm not poor, and what access I have to good health care, the food that I eat and the access to that food, the stresses that my life is under, the different things that interact with my health that make me unhealthy, but that may not have been defined as health before. So that those points of intersection are going to be really, really important for the aging system. Because you've been working out there in the fields of the Lord, I guess, really trying to keep people healthy, seniors healthy, trying to feed them healthy food, trying to get them to the exercise, trying to interact in other ways with the environment. And so while you've been doing this, you've been doing healthcare, whatever else we were calling it. It was not just nice that you provide some social services, but you were doing healthcare in its real interpretation. So how do you bring those two things together? How do you bring the health people to really understand that you're an integral part of that healthcare system, and that if you're taking care of seniors, you cannot do a good job without integrating that aging system. So I think that that's the real challenge. I know that I heard Igal and I heard Nancy in terms of what we don't know about marketing and what we don't know about computer systems and IT, but you do know about how to take care of seniors, and that's the most important, because at the end of the day, those other skills can be brought to you. The ones that you already know are the most important. So don't sell yourself short for that. You've been doing it well, and you've been doing it for a long time, and I think you're a very well-kept secret. And you know, many a time talking to hospitals, I remember the most important thing is that you're free. Remember that. They can send people to you, and we foot the bill first. So that's an important weapon that you have. So don't, you know, yes, by all means, try to make agreements and so on, but really know the value that you have, because it's selling that value that's going to get you to where you need to go. So I hope that the dialogue that was started today with the insurance companies, with the healthcare people, bring you to that point. But trust me, I think the sector is moving towards that place, and I think you'll be an integral part. Thank you for having me.